Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about Modifier 25. Now, what is Modifier 25? Well, according to the Appendix A of your CPT book, Modifier 25 is a significantly separately identifiable evaluation and management service by the same physician or other qualified healthcare professional on the same date as of the procedure or other service. So, what is a good example of this? Let's just say that, and this involves like minor procedures, okay? This has nothing to do with like major procedures. When, like, for example, if a provider decides to do a decision for surgery for a major surgery or a major global care package, like a patient came in with a fracture and the provider decided to do a reduction that same day, then you would put a modifier 57 on the evaluation and management. That is not this, okay? That is a major surgery, okay? That is a major global package surgery, 90 days, okay? We're talking about the minor or other procedures, okay? So anything like 0 to 10 day global, okay? That's a good example, okay? So let's just say, for example, this, all right? A patient comes in and he has osteoarthritis bilateral of the knee, but the right knee really hurts him, okay? And he also says, you know, doc, my ankle hurts. My left ankle hurts because last year I broke my ankle and I haven't been able to shake this pain ever since I broke my ankle, and I just don't know what to do anymore. So the provider decides, okay, I'm gonna look at his knees and find out what's going on with his knees. Okay, the right knee really hurts. Let me go ahead and give him a steroid injection, okay? So I'm going to go ahead and give him a steroid injection. But also, I'm going to do some additional workup on this left ankle problem that's been going on. Okay, obviously, this is a sequela of this injury because he's relating that pain to when he had the fracture. So let's see if maybe the fracture hasn't completely healed, or maybe, something else is going on. Let me order some additional workup. So the provider maybe documents that he's ordering additional workup. He's going to get some additional radiology done, things like that. He's going to order some physical therapy if everything comes back okay, that kind of thing. So that's a significantly separately identifiable service on the same date as this procedure, okay? So in that instance, you would have the evaluation and management, and let's just spitball, okay? This is a new patient, okay? And we're going to go ahead and give that new patient evaluation and management a 99203, okay? I'm just saying, okay? It could be a 204, depending, but this is just imaginary. So 99203, okay? In this imaginary instance, he's doing this additional workup, and that would be a modifier 25 on that, because modifier 25 only goes on evaluation and management codes. It does not go on the procedure codes. So this other, right-sided injection for the pain would be the 20610, okay, with the right modifier appended to it because it's only done on the right side. So those sorts of things are what happens when there's a modifier 25. So always remember, when it is a significantly separately identifiable service, that it happens on the same date as a procedure, okay? A minor or 0 to 10 day global procedure, okay? Or other service, okay? That's when you would append the 25 to that evaluation and management level, because it's letting you know that there's something else that's going on, with this patient on this day. And oh yes, there's a procedure that's going on, or there's another service that's going on. So that's when you would use those. Appendix A is a really good source in your CPT book about, and I'm using the professional edition, CPT professional edition. So if you have Appendix A, in there, you can look at it, and it does describe all of the different modifiers and the particular instances when they would, their description of how they would apply. So if you do get stuck on a particular one and you want a particular one right away, let me know. Now, keep in mind, I don't use all the modifiers myself. My facility does not, I'm not in a setting where I use all of the modifiers that are in this book, okay? So just keep that in mind. If I do have to do research, I will. Research is not a big deal for me. But I know that sometimes it does help to have somebody to explain. So if you can look up, if you're having a particular problem with a particular modifier, right? Then you can look it up and say, okay, I found this, but this is still not making any sense. So that's when, you should reach out and see if somebody else knows, or, reach out here and see if I know, and if not, I will look and try to find what I can. Coding clinics are another great resource for finding more information about modifiers, okay, and when they would apply. So be sure to take advantage of that if you're working with an encoder, and like the 3M encoder, and they have the little stack of books, and you can click on that, and that's a wonderful resource of all different kinds of things that you can find out about modifiers. But yes, so hopefully that clears that up. So modifier 25 is only appended to the evaluation and management codes, and it is only applied when there is a significantly separately identifiable service that is performed on the same day as a procedure or other service. Okay? So, yes, if you guys have any other questions, let me know, and I will be working on the next episode for the next modifier, which I think will be the toes, okay? Because I was going to do the toes ones, and when you would apply a particular toe modifier to like a particular CPT code, okay? Because I think that's really important too. So, not going to dive off into that one, just going to talk about, that's going to be the next one. All right, so if you have any questions, let me know. I will leave my email address down in the description box below. And guys, keep in mind, I'm just a veteran medical coder who likes to share what I know. None of this is official, okay? You should always do your own research as well. But, I like to help out and like to share what I know. So, that's it. So if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. All right, I will see y'all on the next episode. Bye.